Hello, hi everyone. Thank you for joining me on today's talk, this live chat. My name is Dr. Erica Onigbola, registered pharmacist for D. I've been a pharmacist for close to 10 years now, and I am coming to you today on December holiday. So happy holidays to everyone, and thank you for joining me. Season's greetings. Today, I was just gonna come briefly and speak about bisphosphonate therapy for osteoporosis treatment, and especially in those patients who are over the age of 50 and those who are um, over the age of 50 plus menopausal. So, in those particular patients, we may see an increased fracture risk, and we also may see increased fracture risk in certain bone areas of the body, including the vertebrae, non-vertebrae hip area as well. So we want to just remind and reiterate the importance of bisphosphonate therapy and how to consume those medications and how to consume them properly. Okay, and then also there are other anti-resorptive medications such as calcium and also vitamin D therapy that are on the market and recommended in also our dietary nutritional plans. In every meal, there's a certain amount of calcium and vitamin D that we should consume in fortified products. And if not from meals and products, we should consume them by dietary supplement if possible and consistently. So let's make sure that we're on board with all of our medications and preventative care. There's also recommendation from the guidelines for osteoporosis that physical activity should be in place to prevent osteoporosis, and that includes 30 minutes approximately each day of the week um, of exercise, moderate intense level exercise, which can include a brisk walk, a jog, stair walking, and also they recommend a resistant training, weight training. Maybe 2 days out of the week to increase resistance and also build bone mineral density. And that is 20 to 30 minutes, 2 to 3 times per week of weight bearing exercises, like with weight bands or with actual weight to help build resistance and increase muscle mass and also increase balance, flexibility, and mobility. So we want to make sure that we are doing those exercises as well as nutrition, including our vitamins and minerals, and if not through our meal intake, through dietary supplementation as well. Now, for those patients who are diagnosed with osteoporosis, bisphosphonate therapy is a plus and should be taken very early in the day before any meal intake and separated from all vitamins and minerals and other prescribed medications and over-the-counter medications that are in your regimen. They should be separated for about an hour to 2 hours to make sure that the bisphosphonate therapy is absorbed properly and does not cause any or rare side effect or common side effects that are associated with this group of medications. And for those patients who are on bisphosphonates, I'm sure they have been thoroughly counseled about the side effects of the medication group. So one of the main or rare but main consequential effects is going to be the necrosis of the jaw and also ulcers of the gut lining that are associated with bisphosphonates. So it's recommended that patients are very on point with knowing and being knowledgeable about this group. Other side effects that patients may feel is nausea, dyspepsia, flu-like symptoms specifically. And then there's, like I mentioned before, atypical fractures, musculoskeletal pain, and also necrosis of the jaw, which is rare, but it has occurred enough in the population to be documented. And then I want to go over the bisphosphonate therapy. Alendronate is the first one of Fosamax, and it should be taken either daily, 5 milligrams daily, or it could be taken 35 milligrams per week. And then that's for prevention. And then for treatment, we're just going to basically double that quantity per day and per week. Now, Actonel or resindronate is going to be 75 milligrams twice per month or 150 milligrams per month for prevention. Now, some of these are more specific for preventing certain fractures in areas of the body than others. For example, the next one I'm going to mention is Boniva or ibendronate, which is not significantly reducing fractures in the hip area of the body, and also it's not effective at reducing fracture in the non-vertebrae area of the body. So it's not specific for certain bone locations, but it is very well significantly reducing fractures in the vertebrae itself, in the vertebrae specifically, but not so much reducing fracture, like I mentioned, in the hip and non-vertebrae areas of the body. The previous one that I mentioned is Fosamax, and then the Actonel and Reclast are the ones that are specifically reducing fracture in the hip area and also non-vertebrae and vertebrae areas. They're significantly reducing those risk fractures. So if you're on a bisphosphonate that is not significantly reducing risk fracture, known to reduce risk fracture, then let your prescriber know so that they can seek an alternative, so where you can be taking a effective bisphosphonate regimen. So that is not uncommon in medicine. Some in a class of medications, some medications might be a little bit more specific or more significantly studied and researched in clinical trials, and then some may not be as studied or researched in certain clinical trials. And so this is the case for bisphosphonate group. Like I mentioned, bendronate or Boniva is not that significantly known to reduce risk. So if you're on that particular medications, just speak with your healthcare provider. Just ask a simple question: is this the right bisphosphonate? If it is, then it may be, because you might not be at risk for fractures in the non-vertebrae or hip area. So do be aware of that as well. So I just wanted to reiterate some of the key points with bisphosphonates. I had studied bisphosphonates and given it in service before as a student, so I'm happy to revisit this topic with you, okay? And then also, the bone mass density exam should be given periodically for patients who are over the age of 50 and those who are actually diagnosed with osteoporosis. Okay, and the goals of therapy is to prevent fracture and the diagnosis of osteoporosis. And then if osteoporosis is diagnosed, we want to stabilize and improve bone mass and strength, preventing fracture. Then we also want to reduce pain and improve function and capacity, and also quality of life for those patients who may experience those events. Okay, so I am Dr. Erica Onicola, PharmD, registered pharmacist, and I'm glad that I was able to give some insight into bisphosphonate therapy. There are other therapies that are available. Specifically, I wanted to go over the bisphosphonates because it was dear to me, because I had studied it before and wanted to reiterate some of the key points And then also, it's recommended for patients to try other non-pharmacological um, uh, treatment or preventative measures, like limiting the amount of Coke and carbonated products, and also caffeine, and also any alcohol, especially for our elderly or older patients who are at risk for falls. Okay. And then read your food labels. The actual percent daily value of vitamin C and vitamin D will tell you how much you're gaining out of each portion size or serving size. And then based upon that, you can subtract that amount from your daily maximum requirement. And what you're not getting, seek a dietary supplement. So for vitamin D, the max for someone who's over the age of 49 or who's 50 and greater is recommended to have 800 to 1,000 units of vitamin D on board per day. And then for calcium, it's recommended for that age group to have 1,200 milligram of calcium supplement. And again, if you're not getting it in your nutrition, seek your dietary supplementation. Okay. And then also, smoking tobacco is not recommended in patients who are at risk for osteoporosis. We do know for a fact that smoking tobacco has several risk factors and does decrease the quality of life for that particular individual and life expectancy as well. And then patients who are at risk for fall should have their regular eye exam and should have comfortable footing and balancing as well. And that can be helped through exercise training and also resistant activity on a weekly basis or twice a week if we can, using weight machines, free weights, and weight balances to help get that bone density to do what it needs to do so that it can be stronger. We can have a increased body mass, or I'm sorry, bone mineral density. And then also we want to watch our weight, get our weight to its specificity, and then also make sure we're eating properly as well. Okay, and then whatever medications we have on board that could cause us to feel or cause patients to feel like they're experiencing or to experience a fall or fall risk, then we want to make sure we evaluate the medication regimen to be sure that we're not having excess or unnecessary medications on board to where we're feeling that we are putting the patient at risk for fall or feeling of any type of mental instability to where falls can occur, increasing risk for hip fracture, bone fracture, and also imbalance in footing. So we want to be sure that we are on board with the medications that are other medications are not causing drug interactions with each other and or drug interactions that can increase risks for falls. So if there's any questions you may have, please feel free to leave them in the comment section. I'll be happy to get back with you on that. And if you like, share, and subscribe, please do to this channel. Again, I am pharmacist Dr. Erica Onigbola, and I'm a registered pharmacist for close to 10 years. And I do enjoy giving out this important information on a regular basis. Is what I'll enjoy doing and sharing with the public community. So if there's anything else, I will sign off, and I thank you for joining me, and I will put the names of these particular medications in the description for you. And if there's any questions, let me know. Signing off, Dr. Erica Onigbola. Thank you. Bye-bye.